And a chemical is not going to cure chemical dependency. So if the goal is really to cure this disease of addiction, right? If the goal is to really look at addiction as a whole and the lack of coping skills and the lack of self-awareness and the lack of personal growth and development, if that's really your goal, then a chemical is not going to cure that or fix that. Right? So the goal of medication and medication-assisted treatment, right, which is MAT, medication-assisted treatment, is to use medication to assist the treatment. So the treatment would be the counseling and the groups and whatever else you're doing, and the medication assists that, right? This is very different from medication as treatment, which is MAT. Right? So medication as treatment would be more of a harm reduction strategy. So medication-assisted treatment is meant to help to treat the overall addiction. So the medications we have for medication-assisted treatment, we only have them for alcohol and opiates. And for alcohol, we have disulfiram, acamprosate, naltrexone, oral and injectable. And for opiates, we have oral naltrexone, injectable naltrexone, buprenorphine, both sublingual and injectable, and methadone. And those are the only options we have. And I'm not going to go into detail about those things. But basically what I believe is that, medication has the ability to allow the midbrain to rest while strengthening the cortex, right? Because that was the goal of traditional treatment before medication came out, was let's take these people, take the drugs out of their system, put them in treatment or self-help groups and help them build up these skill sets really quickly while they're feeling terrible. Right? And for some people that works fine. But for other people, they're not able to get past that feeling terrible to really hear the message of how to fix their life and find their own personal fulfillment. And so medication for a lot of people allows that to happen. It allows that midbrain to sort of take a nap while the skill building is occurring in the cortex. And that's really the goal in a medication-assisted treatment program. And again, the goal to me should really be more about thriving, right? Reconstructing, right? Because we deconstructed the brain in terms of the addiction. Let's reconstruct it. And where do we go from here? Because yeah, you have to not be using drugs. That's kind of an important piece to be able to kind of build up your life for most people. So stop using drugs. Yes, great advice, super. And that's step one and foundational. But beyond that, what are you doing? Because I feel like for a lot of people, just stopping drugs, we get the participation trophy and the medal and and that's excellent. It's really hard to stop using drugs. But if you're going to continue to pump your body full of chemicals because you eat like crap and you're not going to do any kind of physical movement and you're going to just veg out in front of the TV playing video games, I'm not really sure that that's much healthier or the brain is going to develop in any kind of healthy way. So the goal really needs to be to thrive beyond that, right? So I've stopped using drugs. I've made my life better from that perspective. How can I continue to make my life better? How can I grow and thrive?